Hello, Professor Michael Terence. I'm really excited about this case. You know what? I have the boys. They got the same symptom like that. If you can have a look, does that look like the eczema?
Yes, this particular case is eczema. It's a special type of eczema.
But is that one type of psoriasis as well?
No. It's not psoriasis. Eczema is a different type of skin condition compared to psoriasis.
Wow.
Eczema, there are many types of eczema. There's this particular case is lip eczema affecting the lips.
Yeah. My boy as well, they got the same. They got the lip look exactly the same, the picture, and also it spread to the skin as
to
well.
the face, yes.
Face.
Eczema can spread anyway, but normally in young people, they can get it around the face and around the lips. It's quite common.
Yeah, but do you know, can you tell me a little bit more about the triggers?
Eczema again is a genetic condition. Normally it's passed down again from family members, and it stays dormant until it gets triggered. But eczema is a lot more complex than psoriasis. With eczema, there are what we call initiating triggers that start the condition, and then there are environmental triggers. Environmental triggers can include pollen in the air, grasses, it could include dust mite.
Yes.
So it's a lot more complex than psoriasis.
I think the rust is very important because I can see that my boys have the rust a lot about the lip and their skin face.
Yeah.
Yeah, so I try to use a lot of cream before. So can you tell me which cream the boys in the case
with
use?
this particular case, the boy, his condition started apparently when he moved school.
Oh, yeah.
He went to a new school and he wasn't very happy to go to the new school.
Maybe stress as well.
Yeah, we say children don't stress.
Yeah.
Yeah, we normally associate stress with adults.
Yes.
But children also stress, when a child is not happy, there's a certain amount of stress.
Or maybe the effect from the parents.
The effect from the parents, but moving school. It's a totally new environment for him. So he's not happy at school, he's got problems with school, especially if he's not fitting into the school,
Yeah, I know.
When you move to a new area, it's a little bit difficult.
It takes time to get used to it. So
Yes, and he can't concentrate very much at school, so that's what flared up his skin. Yeah. So his parents took him to see other doctors, and they gave him some cream, they gave him some steroid cream, which helped, but unfortunately when he stopped using it, it got bad. It got worse again.
Yeah,
it went back.
So how about when they took him go to our clinic? So what did you treat him?
Well, when he presented to our clinic, the doctor there had a good look at it and looked at potential triggers that can flare him up. Now, when you got lip eczema, with lip eczema, it can come from other sources. Sometimes the children could lick their lips a lot. So the saliva can affect the lips, but also we look at what the child is eating, because obviously whatever you're putting in your mouth is going to have an impact on it. So we normally look at foods that are very acidic foods, like orange juice can be a problem, pineapples, things
They usually take the orange juice and the pineapple juice every single day.
Yeah, so that can be a problem because it stings and burns the skin a little bit, you see, and that can make their skin worse. So food triggers are very important with eczema, more important than with psoriasis. So we look at histamine foods again, food containing histamine, because histamine makes you itchy. So obviously if the kid has got a condition which is very dry and very itchy already, you don't want to give him foods that will make him itchier. So with eczema, because this barrier function is compromised, the skin is compromised, and they lose a lot of moisture. So it's important that the patient is well hydrated. So we encourage them to, drink a lot of water, Be careful what they do not to warm their body up too much, especially if they do exercise.
But they are child. Is it really hard for them to
It's hard, because it's a difficult time for patients with eczema when summer months come. Because in summer it's warm, it's, it's dry, they get dehydrated very quickly. The heat affects it because the heat dehydrates you.
It gets worse?
Yeah, it gets worse in summer months. And I always encourage them to make sure they wear materials that breathe very well, like cotton. Don't use a lot of synthetic clothing because it warms up and traps the heat and warms up the body. And when the body is warmed up, it'll make you a bit itchy. So all these things is very complicated with eczema. We have to look at all these different issues and as well as treat the patients. So in addition, we've got to give them some with eczema because eczema is very sensitive.
Yeah.
So you can't give very strong treatments. So we've got to give very mild treatments. There's a special moisturizing bar that we use that's for very sensitive skin. So we gave that to him, plus a very mild cream that we made for him. The cream contains a lot of herbal extracts and have been clinically proven. We've got papers on it, and that's what he used.
Yes, how about this case, especially in the lid eczema? So how long to get the results?
In his case, his skin got good results within 2 months.
2 months?
Yeah, most of his skin cleared up within 2 months.
I thought it's going to take longer.
Now, because he needs to look at what's flaring up first. So we got him to cut out the foods that are aggravating his skin, especially all these oranges and acidic sort of foods, because if he eats that, it's a problem because it's going to flare it up.
So anyway, if you would like to have the best results, you have to control your diet as well.
Yeah, with eczema, most skin conditions, there's a dietary component that we must look at. Because what goes in your mouth is what comes out of your skin, right? So if your diet is very good and you look after yourself well, in most cases, your skin is pretty good. Not in all cases, but in most cases. So diet does not start eczema unless you have an allergy. But diet plays a big role in exacerbating eczema.
There is very useful information for me, because especially I got like the kids and I know how to take care of them if they have like the same condition like that. Thank you, Mr. Michael.
Thank you for your help. Thank you.
Thank you.